The problem that we identified in South Africa is the fact that as soon as you go medical aid and you talk Discovery or whatever the products that are available, they are extremely expensive, unaffordable to the majority of the sort of working class and the lower income laborers, etc. Carecross was a great investment looking at from a pure investment point of view that was done into the Development Equity Fund. They provide services through a network of doctors right throughout the country in rural areas, etc. So it's a low-cost alternative for medical aids. So Carecross, through the rollout of its clinics into Soweto, into the rural areas and everything, and through products that they've created to give employers the opportunity to, in certain cases, sponsor or get their workers all on a scheme where they can get medical attention.
It began, interestingly, in this very office, about 12 years ago now. You're probably aware that Soweto is the largest township in South Africa, with a population of guesstimated at around 4 million. So it's ginormous. And that was the big thing about a product like the one that Carecross had brought to the market in terms of reaching people in LSM 3 to 5, i.e. gainfully employed who are earning a take-home of about 3,000 Rand, 4,000 Rand, being able to access primary health care. Service too is much quicker, medicines are guaranteed. The turnaround time in terms of being ill and being able to get back to work is significantly higher than if you are having to access the state system, which is quite burdened, as we all know.
The service is good. I don't have to wait for long hours to understand, to get help. Unlike public hospital, public clinics, where you wait the whole day without getting help.
They examine you properly. They ask you questions if you ask them questions if you need to, and they explain everything that you need to know about what's happening with you or the child. So there they just give you things, you have to tell them what's wrong with you.
Someone on a farming or a rural community that does not have access to healthcare, they're at a huge disadvantage. So we saw this gap in the market to provide affordable healthcare through Carecross to farm workers and to rural communities where they have access to this type of facility, to a clinic that provides primary health care to them through a medical aid scheme. And this has made a huge difference to these communities on farms.
Okunye okulandelayo into esizifumanayo ngoku izinto ezibhekabhede sibe nazo ne-medical aid ngonje into besikade singenazo so safumana uncedakala ngenxa yamaphupho esisasikade siwafuna.
My perspective is basically twofold: guaranteed returns financially, and secondly, talking to triple bottom line, one of the more important things is your social responsibility. So you manage to make a profit, and at the same time you manage to help the community significantly in increasing the number of facilities, healthcare facilities, and the number of people that are able to access primary healthcare cost effectively.